Good afternoon, and welcome to Interventions to Reduce Risk and Promote Health, the Silver Lining Project, a program within Thrive SS. Upon completion of this session, you will gain insight into the Silver Lining Project intervention, and you will gain a perspective on how social determinants such as stigma, disclosure, social support, and health literacy can impact the HIV care continuum. But first, let me introduce my team. This is Darryl Branch. He is a project coordinator at Thrive SS and the Silver Lining Project. Darryl was instrumental in keeping the group alive when he assembled the men of our group for a photo shoot back in 2018. A native of Detroit, Darryl has been living with HIV for more than 17 years, and he is passionate about making sure that we, as maturing Black gay men living with HIV, can live our lives fully and freely. And he works hard to make sure that our space is a safe space. And this is Joe Robinson. He's a project coordinator and a native New Yorker. Joe has been involved in HIV advocacy for more than 18 years. He's the chairperson of Sacramento EMA, HIV Ryan White Planning Council. He served as a board member with the Center for AIDS Research, Education Services. He is was the co-chairperson of the National Community Advisory Board, NIH Adult Clinical Trials Group. He was the chairperson of the UC Davis Adult Clinical Trials Group, Consumer Advisory Group, a fellow of the Black AIDS Institute African American HIV University. He attended various NMAC trainings, the People of Color training in San Diego, and the regional training in Washington, D.C. And he was the recipient of the North Carolina Grantmakers Award. He was the Community Planning Leaders Summit, and he served as an American Red Cross African American HIV education and prevention trainer in Sacramento, California. I've got a great team. I am Malcom Reid. I am the Director of Programs of Thrive SS and the founder of the Silver Lining Project. Thrive stands for Transforming HIV Resentments into Victories Everlasting. And our mission is to achieve health equity for Black gay men living with HIV. I started as a volunteer in 2016 while still working full-time for a major telecommunications company. I co-founded a program called PASAN, the Political and Social Action Network. And then in 2017, I created what is now the Silver Lining Project, a program and intervention to support and enhance the lives of Black gay men over the age of 50 living with HIV. Both of these programs exist under the Thrive SS umbrella and have effectively supported and advocated for Black gay men living with HIV and the broader Black, gay, queer community. In 2016, I joined Thrive SS as a volunteer, as I mentioned, and in 2017, I expressed my interest to start a group for men my age that looked like me who were living with HIV. I started the group and it was called Mature Men of Color. But after a few stops and starts and DC's famous photo shoot, I met these two amazing gentlemen, Claude Bowen and Nathan Townsend. And together we wrote the Silver Skills curriculum. And we received a grant from Gilead Sciences. So what is the Silver Lining Project? The Silver Lining Project endeavors to positively impact the HIV care continuum with social engagement, self-love, and by mitigating the effects of stigma and improving access to care. We do this by utilizing local support models and social engagement networks. And we sponsor support groups and leadership training. The Silver Skills curriculum is a part of the Silver Lining Project and is composed of 4 in-person trainings and 4 live webinars. as well as a retreat and a photo shoot when the curriculum is done. These are the 4 modules of the Silver Skills curriculum. Module 1 is HIV and Aging, and its component webinar is HIV 101. Module 2 is Trauma and PTSD, and its component webinar is Health and Wellness. Module 3 is Loss, and its component webinar is Spirituality. And Module 4 is Stigma, and its component webinar is Advocacy and Action. So in Module 1, we talk about 2 key things. 1, intersectionality. We all live with an intersectionality, and sometimes there are oppressive forces that are common to Black gay men living with HIV. The intersectionality between race, gender, sexual identity, age, class, and the forces of survivor's guilt, internal and external stigma. The feeling that you were not prepared for this season of life because you thought you were going to be dead. And the loneliness and depression that we face as we get older. In Module 2, we talk about trauma and PTSD. We introduce the ACEs study. Each participant is provided a questionnaire to complete so that they can discover how many ACEs, adverse childhood experiences, they're living with. This activity is done individually, and participants are not required to share results. After they complete the questionnaire, they are shown a video of a TED Talk by Dr. Nadine Burke-Harris, where she discusses the origins and validity of the ACEs study. We then move to showing the participants various healing strategies, coping mechanisms to deal with the ACEs that they are carrying with them. In Module 3, we talk about loss. We introduce the participants to various degrees of loss and the stages of the grief cycle. We explore and discuss survivor's guilt and provide skills to cope and help others get through the cycle of grief. We teach the power of empathy. And in Module 4, Stigma, we introduce 4 types of stigma: stigma by association, public stigma, structural stigma, and internalized stigma. The purpose of this module is not only for the participants to be aware of the different types of stigma that they are facing, but also to give them the tools to overcome that stigma. Our goal is that by the end of this module, by the end of this curriculum, that they are able to walk away feeling better, feeling that they can deal with the stigma and equipped to deal with the issues that they face every day. In this slide, one of the authors of the Silver Lining Project, Claude Bowen, talks about how stigma impacted him and how he overcame. He says, "Stigma made me do it. Stigma is often the silent element that influences behavior. People respond to stigma in a different way, and I, for one, attempted to blend in with a society that was very judgmental and not affirming to me at all. So I hid. I pretended to be all that I was and all that I was not, and that made my life very complicated and uncomfortable." He goes on to say, "I got married because I thought it would change me. I became a Marine because I thought it would change me. I became an ordained minister because I thought it would change me. And I became a member of Thrive SS, and that did change me." So as I mentioned, after the curriculum is over and we've processed all of those feelings of fear and loss, trauma and stigma, it's time to get away. And so we take a trip up to the Georgia mountains. We get a cabin for about 3 or 4 days and just enjoy each other process what we've learned, and have fun as brothers. And what's a better way to defeat stigma than to show yourself to the world? So we put on what we call our I Thrive photo shoot. The pictures are displayed in our Cultural Engagement Center, and the participants are encouraged, and they don't have to, but they're encouraged to share them on social media. That's the final declaration of freedom. So let's talk about evaluation. All of Thrive SS, the overall Thrive SS program, was evaluated in 2020 by Research Science and submitted by ICF Atlanta. Lisa Hyam Carver, Master of Public Health and Manager of Research Science, and Catherine Lescence, PhD and Master of Public Health, Vice President of Research Science, contributed to this evaluation. The evaluation consisted of 3 main questions. The first question was, have participants of UA experienced reduced HIV stigma, increased access to HIV care, increased HIV health literacy, increased comfort disclosing their HIV status to family and friends and sex partners, increased social support, and increased adherence to HIV care. Now, as I mentioned, this was an evaluation of all of Thrive support services. However, we in this presentation are looking specifically at the impacts to the members of the Silver Lining Project. The second evaluation question was, what types of activities and services do UA participants engage in? And what are the challenges to participating in UA that members experience? And then the third question, how has the COVID-19 pandemic impacted UA members in general and as people living with HIV? The evaluation employed mixed methods design consisting of a retrospective pre and post, quantitative survey, and qualitative interviews to measure the outcomes of UA. The survey was administered through a web link, and semi-structured qualitative interviews provided a better understanding of the impact of UA and captured the member perspectives and experiences beyond the survey responses. So these charts show the progress experienced by the members of UA and the Silver Lining Project in 4 key areas: stigma, HIV health literacy, social support, and disclosure. Overall, we see that the older members reflected better measures when they started the association with the Silver Lining and UA, but the performance measures still improved. Even though they were better in the beginning, they still improved during their time with UA and Thrive and the Silver Lining Project. Our internal pre and post engagement survey for the Silver Skills participants revealed a 60% increase in overall mental health, a 50% increase in social support and belonging, a 60% improvement in feeling and perceptions of stigma, and a 37% increase in the abuse of alcohol and substance use. And the last member of the engagement survey, the last members engagement survey for Thrive SS overall showed a 94% viral suppression rate and a 93% rate of retention in care. When we looked at the qualitative data around health literacy and increased social support, the theme of mentorship was profoundly identified. Younger members trust the older members of the Silver Lining Project in all aspects of life, including HIV literacy. One of our younger members said, UA helps me remember to ask my doctors questions like about drug interactions. The empowerment is in figure out how to coordinate my care between providers. UA reminds me to connect the dots between my care, what questions to ask, sexual health, mental health. I'm more likely to check out the information that the medical providers give me because of hearing things from the UA members, especially the members in the Silver Lining Project. I really trust them. I no longer accept my doctors, what my doctors tell me without understanding. When you're able to tell your own story and you're able to be comfortable and walk in your own space, you don't feel demonized, you feel elevated. And that was from a member of the Silver Lining Project. So we see that this increased social support and increased health literacy spurned a measure of mentorship where the Silver Lining members feel more comfortable discussing things with the younger members and helping them to come along. The qualitative data from the interviews on stigma and disclosure revealed educational opportunities surrounding the LGBTQ community with a level of interest and empathy. One of the members of the Silver Lining Project said, UA puts me in a position to be open around people beyond my sexual expression. Men who are masculine and feminine. I learned what non-binary means. All this makes me feel closer to all of them as my brothers. I want to wrap my arms around everyone in this network and give them the love I feel because of it. That's powerful. And so finally, Thrive SS and the Silver Lining Project have positively impacted the Black SGL community in Atlanta and other cities through our online support and the deployment of the Undetectables model. Further enhancements to the model in 2019 introduced the Silver Lining Project, which has not only continued to mitigate stigma, improve social support, health literacy, and disclosure, but has also introduced a feeling of mentorship to the younger members of UA. An overall decrease in the community viral load can be directly attributed to the sense of mental well-being and confidence fostered within this group. Thrive SS's executive director, Larry Scott Walker, has coined a phrase, there is no pill to build will. Well, because of what we do every day, we like to think we are that pill. We are building will. Thank you so much for spending time with us today. I know you have questions, and I look forward to talking to you during the question and answer period. Thank you.